Earlier today, I spoke with the president's senior advisor, David Axelrod, about whether the White House believes a health care reform bill will be enacted this year. Are you confident you have the votes to pass a bill?
I am confident that we are going to do this, Charlie. I don't think we can afford to fail. I don't think we will fail. Congress understands that, and we understand that.
Is that a yes?
I believe we're going to get it.
You got the votes.
I think we will have the votes to pass a significant health insurance reform plan this year. Absolutely, yes.
Our chief Washington correspondent, George Stephanopoulos, is joining us now. David's interesting there. We will have the votes. Sounds like they're not confident they have them yet.
Because they don't, Charlie. They don't have the votes right now for a bill that can get through the House, get through the Senate, get to the president's desk for his signature. They know that. That's why they're giving the speech tonight. It also comes at a time when the public, even though they back the president on this idea that the status quo is unacceptable, back the general idea of health care reform, now polls show that a majority of Americans don't support the specific plans being kicked around Congress right now, and a majority of Americans don't support the way the president has handled this issue.
They want some Republican votes. They have talked from the beginning about desiring bipartisanship. But the House leader, John Boehner, today had this to say.
What the American people want us to do most right now is to do everything we can to make sure this doesn't happen.
It doesn't happen. The Republicans monolithic in opposition?
Right now, just about, Charlie. Pretty monolithic in the House. Right now, it looks as if Olympia Snowe, the Republican senator from Maine, is most likely to join the Democrats in some kind of bipartisan deal, even though the talks haven't officially broken down with other Republicans. And leaders in Congress from both parties are expecting this process going forward to be an attempt to unify the Democrats without much Republican support for this bill, unless it gets momentum and it scrambles the dynamic later on down the road.
And then, George, there's this issue of government-backed insurance, the so-called public option. Now, David Axelrod said to me, the president today will say he still favors it. He won't insist on it. He won't say he has to have it, but he still wants it. But a key senator, Max Baucus of Montana, today said this.
I think, frankly, with increasing conviction, that a public option cannot pass the Senate.
He says it can't pass the Senate. Nancy Pelosi says they need it in the House. So where do the Democrats stand?
And the president couldn't solve this inter-party dispute yet, which is why he's talking about it tonight in the way he's talking about it, saying he supports it, but he's not going to draw a line in the sand. What this means, Charlie, is that basically the president is kicking this problem down the road until this issue gets to a conference committee where he'll have to try to solve it again. But he wasn't able to solve it before tonight. There's going to be a vote on it in the House. It won't go through the Senate.